Kia ora koutou katoa. Welcome again to the Ministry of Health here in Wellington. Thank you for being here at the media update today. New Zealand has no new cases of COVID-19, so the tally overall remains the same, 8 confirmed and 2 probable cases. I can provide an update on the 2 cases announced yesterday. The first was a man in his 60s visiting from Australia who was tested in Australia prior to flying to New Zealand. He is now symptom-free but remains in self-isolation with 2 family members, all are well. The other case is a woman in her 30s who travelled from Denmark to Queenstown. She was unwell and was hospitalised for one night. In Queenstown, she is now discharged and is recovering in monitored self-isolation. Contact tracing on the flights has changed to be the following: 2 seats in all direction from the person who is the case. That is to the front, back, both sides and diagonally. This change is following a review of current evidence and is in line with the approach taken by the European Centre for Disease Prevention and Control. And so in both instances for these cases who had taken flights to New Zealand and the woman had taken an internal flight to Christchurch, public health staff are conducting the relevant contact tracing, and close contacts will be required to stay in self-isolation for 14 days from the point of their potential exposure. Healthline does know the relevant seat numbers for all the flights and will be able to advise anyone on the flights whether they are considered a close or a casual contact. Our border restrictions, which as you know were strengthened considerably over the weekend, our assertive contact tracing and self-isolation with monitoring means we continue to successfully have a range of actions in this combined keep it out, stamp it out and slow down the progression of COVID-19. You'll also recall that yesterday a passenger on the Golden Princess cruise ship was tested for COVID-19. That test was negative and the Golden Princess has now left New Zealand waters. There are other cruise ships in New Zealand, such as the Le La Pérouse, which is currently in Wellington, and that arrived, as did the other ships still in New Zealand waters, before the restrictions went in place. Some have been in New Zealand waters for well over a week. I should point out that all ships, as they arrive, are cleared by health authorities, and as you can imagine, over recent weeks, there has been a high degree of scrutiny of the declarations made by either the master or the ship's doctor. All ships have health staff on board them that go with the cruise. For those cruise ships that are finishing their visits to New Zealand, I just commend New Zealanders for continuing to greet visitors as warmly as they normally would, except perhaps for avoiding shaking hands or hugs, and use the now well-described East Coast wave or the elbow bump. Self-isolation. I want to thank the thousands of people who have responded so positively to the self-isolation process. As I have said many times, this is a high-trust arrangement, and I have great confidence in the trustworthiness of many people and that they will be doing their best for this arrangement for the benefit of all New Zealanders. It requires us to act collectively. Self-isolation is one of the most effective ways we have of keeping individuals, families and communities safe and stopping the spread of COVID-19. And if we look to the countries and jurisdictions that have successfully stopped widespread outbreaks, even though they have had infections, this has been fundamental to their success. There have been a number of calls to Healthline on self-isolation, and we have up-to-date information on the Ministry of Health's website. I'll talk about that more now. Every situation is different, but at its most basic point, it means staying home if you are sick or if you have been in contact with the virus, or if you are a close contact. For people who have travelled back from overseas but are not symptomatic, but are self-isolating due to the fact they have come in from overseas now, it means taking simple common sense steps to avoid close contact with other people as much as possible. And you can go outside, yes, but it's avoiding close contact with others. Close contact is by definition where you have face-to-face contact closer than 2 metres for more than 15 minutes. You can still enjoy biking or walking or running, of course, alone rather than with others. Gardening, you may wish to arrange with your employer to work from home. These are all absolutely fine, of course. You should avoid having visitors to your home, but of course it's okay for friends, family and delivery drivers to drop off food and supplies, and of course there's no problem having a conversation with them if you retain that 2 metres distance. Do not use public transport, taxis, Ubers or similar transport methods during your 14-day period. You may of course use public transport, of course including internal flights, once you arrive in New Zealand if you are asymptomatic, for the sole purpose of returning to your home or wherever you intend to self-isolate, but should not and cannot use it after that. You can, of course, go out for a drive or a ride, as I've said, but do not go with others. Yes, of course, you will be sharing your home or your dwelling with others during your 14 days, I suspect, but even inside your own home, you can avoid close contact with other family members or flatmates or others whom you live with. And that is through minimising the time you spend in shared spaces, such as bathrooms, kitchens and sitting rooms as much as possible, and keep shared spaces well ventilated. Fortunately, it's still warm enough to do that in most places in the country. Don't share beds, linen or food, and clean regularly. And it wouldn't be a stand-up if I didn't say wash your hands often, cover coughs and sneezes. On to Healthline. Healthline has been facing huge pressure, and of course with the announcements made yesterday was there was huge demand for Healthline with over 4,500 calls, 3 times, in fact 4 times in the same day last year. A number of actions have been undertaken to address this. These include prioritising callers with genuine health issues. Another 50 nurses have been brought on board to help with the surge, including additional support from ambulance and Plunket line staff. There is a referral to a separate call centre for calls that are about the mechanics of self-isolation and following up people in self-isolation. So those outbound calls are now being done by in some cases by other call centres. I do want to just encourage people, if you just want information about COVID-19, please go to the Ministry of Health website. Otherwise, you are preventing people who genuinely do need clinical advice from getting that clinical advice, and they are forced to wait longer. So don't call Healthline for travel advice, please. Access the Safe Travel website. Don't call Healthline for advice on whether or not you should attend an upcoming event. Please call the event organiser, or again, there is information on the Ministry of Health website on mass events. And instead of calling Healthline if you require government assistance, there is a dedicated service for that. The number is 0800 779 997, and that's open from 8 a.m. to 1 a.m. 7 days a week. I'll finish my opening comments there, and I'm happy to take questions.
How are you going to ensure people self-isolate?
So the mainstay of that is, of course, trusting that people will do it, and we've seen thousands of Kiwis do that. However, as you will also heard the Prime Minister talk about, we do intend to, in addition to the telephone follow-up, and everyone coming into the country is required to fill out now a separate health card with their contact details. In addition to the follow-up phone calls, we are in the process of working out doing spot checks, and those will be happening on people to ensure that they are undertaking appropriate self-isolation.
Australia's looking at fines for people that aren't self-isolating properly. Is New Zealand considering it?
Yes, we are.
What would likely the fines be?
No detail on that, but we are actively starting some work on that, and we will do that expeditiously.
Is that something you're talking to the government about, or is it something
Yes.
from the ministry?
No, it's a cross-government look at that. It's, actually, the advice around what sort of fines might happen, it would not come from us, but it would come from probably the Attorney General's office.
Has the Ministry of Health, their prosecution team, had any cases referred to it?
No, and we wouldn't be doing the prosecuting this early. We haven't had any cases referred. Of course, as with other enforcement activities, including health enforcement activities and even police enforcement activities, there is a range of approaches that can be taken, and we're looking at all of those. I would distinguish the spot checking, which I think is a form of auditing, from actual enforcement. But rest assured, the Medical Officer of Health can require people to be in self-isolation if there is a public health risk, and if needs be, can call on the police to assist in enforcing that.
We already have a person at international arrivals in Auckland after the 1 a.m. cut-off saying that they would only self-isolate if they got sick. Are you confident asking people to self-isolate will work?
I'm confident it will work for the vast majority of people. There has, I understand, been a number of people who have said they intend to continue as they intended to do when they first arrived. We're actively following up those people, and just rest assured we are doing this to ensure that New Zealand and New Zealanders are protected from having a severe impact from COVID-19. This is a really important part of our response.
And taxi drivers have been pleading for information on whether or not it's safe to carry people. What's your advice for both taxi passengers and drivers?
So our recommendation is to people, if they can take private transport home, they should do that. However, remember that what we are talking about here is people travelling from overseas who don't have any symptoms. If they are symptomatic, then of course they will be identified or should identify themselves at the airport, and the appropriate assessment can be undertaken. Asymptomatic people, yes, the intention is that they can get home, and if they don't have any symptoms, in fact, whether they have travelled from overseas or in fact are already in New Zealand, if they have symptoms of any illness, then they should be staying at home or using other means to get home.
With regards to people that have just arrived into the country and if they're backpacking around New Zealand, say in a camper van, could that possibly be a form of self-isolation or not?
Yes, it could be appropriately, and in fact you'll recall that the folk who got evacuated out of Wuhan a month or so ago were housed in camper vans at Whangaparoa. And so a camper van could be. The point here is that they make arrangements so that they are not coming into contact with other people, and in my mind that would mean not using campground shared bathrooms and toilet facilities, so that would need to be a self-contained camper van, and of course not visiting the usual tourist spots. When other tourists are there, they may need to go to them at a time when there are no other people. Remember, this is about physical distancing, and I made the point yesterday, it's not about social distancing. In fact, we need to be more socially connected. It's about physical distancing. If they are asymptomatic, of course they are. If they are symptomatic, then a much stricter self-isolation should be undertaken.
How many people have arrived since the 1 a.m. deadline and gone into self-isolation?
Several thousand have come in, but what I can also say is that in Auckland, usually on a Monday morning, there would be around 2,400 people, and this morning it was 1,000. So there's already been a significant reduction in the number of people arriving.
On the case of the confirmed case from Australia, we've been told that he attended the Strasbourg 1518 show after testing positive. Are you aware of that?
Yes, the Public Health Unit is following up has made an assessment of everywhere he went and whether there are close contacts or casual contacts, and is providing advice to people accordingly.
So you understand that he sort of proceeded with his daily going about after receiving confirmation that he had been tested positive?
In fact, he had the test in Australia and travelled before he had the results. We were notified by the Australian authorities the day after he arrived that his test was positive, and we then made contact immediately. So until that time, yes, he had gone about his business as he had originally intended. He has not since, because he has been in self-isolation.
So once it was confirmed that he was positive, he then went straight into self-isolation. He didn't continue to be about.
Correct.
Okay. And so will you be releasing a list of sort of the places he'd been, the bars and cafes that he went to?
No, I need to leave that to public health authorities to do an assessment, and if there is any sense that there is a risk, albeit small, including there might be casual contacts, then the Public Health Unit will say which places the person had been. But that's part of their risk assessment.
And just part of the rest of his family, so they are in self-isolation as
Yes,
well?
with him, yes,
And
thank you.
with regards to him, I understand he may have been moved from his hotel. Can you confirm that and where his whereabouts?
I don't know his whereabouts, but I do understand, yes, that was some alternative accommodation arrangements being made, but I'm not sure those are. But the public health unit will be overseeing that.
Is that because the hotel wasn't appropriate, or is there some other reason he's been moved?
No, I don't know the reason for that.
Looking at accommodation then, so how many tourists have arrived in the, since the deadline and not had anywhere to self-isolate? Have you had to help anyone find somewhere to stay?
Well, the team at the airport would be doing that. What I can say is that as part of the arrangements of the airport, what we are doing now is questioning people before they get to immigration, to the customs desk. And they need to be able to demonstrate, and all travellers coming to New Zealand, they need to be able to demonstrate what their arrangements are for self-isolation and have some evidence to demonstrate that that is the case. And if we are not satisfied that is the case, then we will facilitate them making arrangements to fly back to where they came from.
Can you
What's
give
the number
details?
of non-genuine calls that Healthline is getting? Obviously they're inundated, but
Yeah.
how many of those are serious requests?
So I think, I don't know the proportion, but I think that many of the additional calls yesterday were people who had either just arrived back or were on the way back wanting to know about self-isolation. And again, there's really good information on our website. And as people come through the border, they're getting that information handed to them and can also ask and have any questions answered.
And so in regards to Tracy Martin, who had been sat next to a confirmed case, can you outline why she hasn't been tested?
So in New Zealand and in other countries, most other countries, people with symptoms are tested, not asymptomatic people. So we don't routinely test close contacts, even if they're in self-isolation. We test them if they become symptomatic. What I would say about Minister Martin, because this is a question we've been asked, and there are other MPs, I think Chris Bishop is one, and some members of the New Zealand cricket team are voluntarily going to self-isolation, even though they returned to New Zealand prior to midnight last night. And I think that's commendable. And others who have any doubts that they may have been in a country where there is quite an outbreak, I would encourage them strongly to also self-isolate. That is, the physical distancing, even if they arrive before the midnight cut-off.
Can I just clarify? So if you are wanting to make sure that we don't get into a community outbreak spread, why you wouldn't proactively test people who have been in close contact? I know that's a concern for a lot of people
Yes.
as to how you're going to detect community spread if you're not actually, checking the community.
So first of all, the people who are who are close contacts go into self-isolation. So they can't, remember that if they're symptomatic, then they will be tested. If they become symptomatic, they will be tested. If they weren't symptomatic, then they don't, the evidence suggests they don't present a risk to others. Of course, we also, secondly, have much wider testing happening, and we can see there's a lot of people who are ringing Healthline if they're concerned about symptoms. But we also are doing and gearing up our surveillance of samples that might be taken, people presenting to GP clinics over coming months. We have a group of sentinel general practices that swab several people a week who have influenza-like illness. In addition to testing for influenza, we will be testing for COVID-19, and that will help us track if we do have wider COVID-19 in the community.
Just two more questions, please.
Okay,
What's
one
the
more here,
threshold for
one here, and
testing?
then
How is it going in hospitals? Because you've been testing people with respiratory-like illnesses in hospitals. What kind of results are you getting back? We're hearing that there's been cases in Wellington Hospital that haven't been confirmed by the
any positive test would be reported to us. Yeah, and we haven't had any positive tests from that testing of people in ICUs or other wards. I'll take two more. There's one here, and then I'll come back to you.
What's the threshold? Because we've also heard that people with fevers that don't exceed 40 degrees Celsius won't be tested for coronavirus. Is that correct?
38 degrees. Yes, they may be. So there is a cluster of symptoms, and the case definition has been adjusted. So it previously was fever and cough or shortness of breath. It is now fever or cough or shortness of breath. And we also know that some people have quite mild symptoms, so it could be a runny nose and sneezes and a sore throat. And if they have that, plus a travel history that is suspicious or contact with a confirmed case, then yes, a clinician can test. So some people don't have the fever above 38 degrees, but there is now the option for those people to be tested.
What's your
Fine
advice to
question.
people for large gatherings? Should they be cancelled, and what is the number limit?
So the Prime Minister will be making announcements on that later today, because that is an issue that's being considered by Cabinet this afternoon.
And so is it reasonable to think we haven't had a community outbreak and we're just unaware of it?
It's always a possibility that there is one we're unaware of. There is nothing to suggest there is, and I think we've got really active case finding and contact tracing, which is designed to stop that community outbreak. And of course, there is a lot of people who, with concern, are ringing Healthline and getting advice around what to do. Again, just to finish, if people are worried, ring Healthline, or if you're going to see your GP, please phone ahead. Thank you very much for your interest and ongoing support.